We're expecting a possible vote in the Senate this week on the GOP's health care bill. This morning on CNN's State of the Union, Health and Human Service Secretary Tom Price defended Senate Republicans' plan to repeal Obamacare, and by doing so, he made a pretty big promise.
The plan that we have would put in place would not allow individuals to fall through the cracks, we would not pull the rug out from under anybody, we would not have individuals lose coverage that they want for themselves and for their family. We want to make certain that health care is available to all Americans. Right now we've got 28 million Americans who are uninsured, who don't have insurance right now in the current plan. Is that a plan that works for patients? Absolutely not. That's the kind of thing we're trying to fix.
I want to look at a different part of the plan before the Senate, and certainly what we saw in the House as well, and that is that it would slash taxes on the wealthiest Americans. Looking at the bill that came out of the House, billionaire investor Warren Buffett said that your plan would reduce his tax bill by $680,000, and he has a question for public officials that I wanted to pose to you. Let's listen.
I think it would be very interesting for the constituents of every congressman that voted for that bill to ask a question, just one question: are you above 250 on your adjusted gross income? And if you were, how much would you have saved from what you paid last year from this bill you just passed?
So what's the answer? How much would you save under the House and Senate bills?
Well, remember that Obamacare taxes were put in place to build a whole new government program, government-run health care. When you back out of that, when you make it so that you've got a patient-centered system where patients and families and doctors are running health care and not the federal government, then that of necessity allows you to do so with not as much money. And so we believe it's absolutely vital that we decrease taxes for the American people, allow them to keep more of their hard-earned money. Dana, did you appreciate, and I don't know if your listeners do, there's 6.5 million Americans right now who are paying $3 billion in penalties, in taxes, just for the privilege of not purchasing health coverage. Can you imagine that? That's a system that isn't working for those 6.5 million. How about lowering the taxes for those 6.5 million?
And I understand that, but the question now is, when it comes to the bill that is before the United States Senate, the fact of the matter is people like you are going to get a tax cut.
Well, the fact of the matter is that those 6.5 million will no longer have to pay $3 billion in a penalty or a tax to the federal government because they're not interested in purchasing what the government wants to force them to buy. Look, this is a system right now that is run by the government, for the government, dictated by the government, and it's not responding to patients' needs. And that's what we want to get to.
I want to